Okay, well, I'm going to assume that we are live. We're so happy. No technical difficulties today. Good morning, or I guess good afternoon, Dr. Coffman. How are
Good
you?
morning, Allison. I'm great. How are you doing?
I'm good. And good morning, Dr. Eckert. How are you doing?
I'm good. Thanks for having me.
Well, good. Well, before we jump into this, for those of you who are now tuning into what is our third Calling Dr. Kaufman episode, I wanted to welcome our very special guest. So she may be very familiar to some of you. Her name is Dr. Kim Gaines Eckert. She's a licensed clinical psychologist right here in Chattanooga, Tennessee. She and her husband co-founded Roots Counseling Center, where she also maintains a private counseling practice. She has just been so helpful to so many individuals and families in Chattanooga. She's a nationally recognized speaker. She talks about wholeness and sexuality and anxiety, stress, all of these things that now she has been willing to come on here for a few minutes and share her wisdom and expertise and some tools with the two of us and all of you. So Dr. Eckert, Kim, thank you so much for joining us today.
Yeah, thank you,
I'm
Kim,
so glad
for
to be
being
here.
So we're going to get right to it a little bit. And Alan and I had been talking about how, well, really, we talk offline about the things we hear from not only Dr. Kaufman's patients, right, as a pediatrician, but also things anecdotally we both hear from our friends, and also the things that we're experiencing. And I will say, like, in advance of this, Dr. Eckert, I was watching the short video that you sent us of one of the presentations you gave. And at the beginning of it, I know we're going to go through some of this at the end, but you had everybody sort of stop and close their eyes and breathe. And I'm always a little skeptical of these mindful techniques. And I said, okay, I'm going to embrace it because I want to do this. And I'm literally, I'm like in my closet watching you on my iPad. And I stopped and I closed my eyes and I just started crying. And I realized that, oh my gosh, I've been holding on to, I'm going to tear up now. I've been holding on to so much, right? Like anxiety. And I always say, I'm not an anxious person, but I'm probably going so fast, like I think all of us do. And so many people watching, that I don't give myself the grace to like literally sit down and just breathe and take it in. And then I realized, oh my gosh, I need Dr. Eckert more than anything right now to help us get through this and give us this grace. I know, Dr. Kaufman, you've experienced some of this too, right?
Well, and I think that was surprising. That was the most common response I got to our first episode. Was I talked to folks that had seen it, and they said, I just sat there and cried the whole time, and just realizing, kind of taking a moment to sit with all this and realizing how much stress it was causing. And the first 2 weeks when this started to develop, for me personally, just the news was new. We were literally getting updates by the hour in regards to what we were being we were being told was going on and what we needed to do, and having all these things that we were responsible for. And I know, Allison, you and I have talked about how we find ourselves having kids that we're concerned about them getting infected and getting us sick, and at the same time we're dealing with parents. And my wife's mother is in a assisted living home, and she hasn't been able to see her, visit with her for 6 weeks. And my parents, help coaching them through that. My dad's a minister with a church and is thinking about, those issues. So it's just so much. And I had, and I'm lucky I got to the third week of this. I just shut down for a week just to take a moment to take a breath. And that really helped. I was able to reset. But I think across the board, it's impacted so many aspects of our lives. It's hard to not have some stress as we walk through this.
Yeah,
all right, so help us. this is our personal and professional pleas for help, and for everybody listening right now, right?
I mean, nobody else feels this way, so I don't know. I mean,
we're weird.
That's really unusual, but no. I am having these conversations with people that, come to see me, with friends, with my husband, with myself. It's so much. There's so much internally, in a small scale and a large scale. The exercise that you referred to was about pausing for a moment and taking a breath to notice ways in which you were present, and then ways in which you weren't present. And I think both of those and several the things that you're mentioning there are a lot about space. And when it's just so much, that is a lot of what we're talking about, needing some space to breathe, right? And to kind of gather, to be able to respond in the ways that we would like to, in healthy ways and adaptive ways, and to be able to create space for ourselves and for the people that we love and care about too. And so hopefully we can talk a little bit about ways to do that today.
And can you, like, I think anxiety is kind of a 4-letter word. It's like, oh, anxiety's bad. Can you speak to, just round that out, give us a little more meat on the bone in regards to what anxiety is?
Yeah. Well, I've heard lots of different definitions about anxiety, and sometimes people talk about the difference between anxiety and fear, and I think that can be really helpful. But at the end of the day, what I really try to communicate to people is just that anxiety is normal. It's part of the human experience. It's like going outside and looking at the landscape and seeing the color blue. It's just there. It's part of the world. There is blue. Blue is there. Sometimes the sky is really blue. Sometimes it's gray. Sometimes it's there. It's part of the world. And sometimes it's stronger than others. And that's part of what we experience internally. Now, the way it works for us is it's part of a response system designed to keep us safe, right? So our brains are constantly kind of scanning the environment for threat, for danger. And so when the anxiety response system is activated, it's designed to keep us safe. So not only is anxiety normal, but it's there for a reason. It's there to tell us, like, do something, right? Do something to be safe. Yesterday, I had an experience of this. I went in to pick up my kids' homework packet, and so my kid's elementary school, it's just the lobby, and I go in to pick up his little packet, and my neighbor walks in as we're leaving, and she's wearing a mask. And immediately, and this is really, from a psychological perspective, this is why masks are good, because it's a visual trigger, and it triggers an anxious response, right? Because it says, oh, there's a threat, and that there is. And so it's good. We should have that. In my mind, in that moment, I was like, I should be wearing a mask. Why am I not wearing a mask? But also, why do I have to wear a mask here? So I had this kind of anxious response, but it just reminds me of, like, that's what anxiety is for. It says, do I need to do something? Do I need to do something? And so most of the time, an anxious response is to trigger an action. The difficulty is when we don't know what to do, or when it's just chronically activated. And so the whole season that we're in right now, what's happening is that for a lot of us, we're just in weeks and weeks of a chronically activated kind of fight or flight response, or a chronically activated anxiety response. And that's exhausting.
Yep.
It has impact on the body, on sleep, on attention, on emotions. And so that's tough. And figuring out some ways to deal with that can be helpful, because just that elongated is not something we've ever dealt with, right? I mean, none of us have been in this situation before.
Well, and I think too, like, realizing, I mean, for me, I was surprised by how much energy my anxiety was taking, and then also how much time it was taking. And just, can you speak to, like, giving yourself permission to let that be real, and then shifting your budget, your time and energy budget to deal with that? Because, like you said, I mean, I'm dealing with today, and this is where I'm living. I don't know if it's going to be different tomorrow, and I need to be ready to do today.
Yeah, sometimes I think about anxiety as anxiety is a kind of energy. And so for some of us, I mean, we use that in different ways. So for some of us who are maybe more driven, achieving types, I'm used to using anxiety as a fuel, right? So anxiety has been like my fuel to get stuff done. Yeah. So I can use anxiety to get a lot of things done and go. But then now we're in this different situation where anxiety is not productive, but in a place where it's draining and there's nowhere to put it, and it's draining life out of you. And so I think you asked about budgeting. Some of the things I'm talking about with a lot of people are being mindful about these, noticing for yourself. And this is really different for everybody. Noticing for yourself, what are some of the things that are really draining your energy source? So I'm sure we could all come up with some really obvious ones, like news and social media and news sources. And so how much news you take in and when you take that in is a good thing to think about and to be intentional about. If you are reading 2 hours of the news as you're laying in bed trying to go to sleep, and then you find that you're having problems sleeping, that might be something to change, right? Change when you're reading the news, change how much you're reading the news, change the, maybe the sources or giving yourself permission to have budgeted amounts of time. The world isn't going to change based on whether you consume information for 12 hours a day versus, 1 hour a day. Or
I'll just add to that too. I mean, I even told, I think Dr. Coffman the other day, I'm avoiding shows on Netflix that give me anxiety, right? If it's, I usually like the Ozarks or the things that are on edge. I've got to put those on the back burner. I'm watching things like Parks and Rec and Community, and like anything that's sort of like mindless, and not that, I don't mean to offend the writers of these shows, but something that's giving you like sort of that release and that permission just to go into an alternate reality that isn't so serious. Because I literally watched my husband watch this show, and his breathing, I said, it looks like you're doing Lamaze class. He's like, and I said, you're giving me anxiety because of your anxiety. So I knew by default I could not watch those shows. It would add something that I didn't need, right?
I think, Allison, that's a good point. And also knowing that for yourself, and also recognizing that what is true for you is not going to be true for the next person, right? So I have an ongoing joke with my husband about horror movies, which I detest and don't understand the purpose of, but he loves them and thinks that they're a great way, a great release, right? It's just a total alternate reality and kind of pressure release. And so knowing for yourself the kinds of things that help for you to be able to have a healthy escape, right? And I think you're gonna maybe talk about that topic in depth more in a different episode. But being able to know for yourself, like, having a break, being able to take a pause is important. And so if watching Ozark is not a pause, then it's not a pause. And if reading biographies is no longer a pause, then it's not a pause. So maybe going to something different is, and to find that. One thing this is kind of shifting gears to something practical, but one thing I am really encouraging people is to look for familiarity and some routine. And so if you're finding yourself struggling with some things that you used to enjoy, like reading or maybe movies or shows or things, to consider revisiting some things that you loved in the past. So some books, or maybe even a book series or a book that you loved in the past, or a genre that you liked, or movies that you watched in the past, or music that you listened to. Because when we are anxious, our whole body system feels unsafe, right? So when we can do something that triggers a feeling of safety, then we're triggering our brain to say, like, okay, this is safe. This feels good. I've been taking my kids to their elementary school to the parking lot, and they ride their bikes, and I jog because the gym is closed. So I run laps around, and I have a playlist that I made when I was training for a race a few years ago, and I listen to this same playlist. And it is boring, I will acknowledge, because I listen to it every single time. every single time. But I listened to this same playlist when I was training for this race a few years ago. And so when I run, I feel like and I can feel like it's an emotional safety, familiar comfort.
Yeah.
And that, and the rhythm of a kind of repetitive like running movement, which is also helpful in other ways, and being outside, a whole bunch of check points.
So when your hairstyle goes retro in a couple weeks, we'll know why. What?
I mean,
that was 2012. Is that what
I
that
could go way back if we're gonna go.
Girl, I got you. I was like, when I stopped straightening,
I don't have you, Kim. I don't have you.
Right. So I don't want to rush us, but I do want to you talked about the practical side of this, right? And I love what you're saying about, your running list, and it, might seem rote for some, but I feel like that's why we're all on these Zoom calls with our high school friends and our camp friends and even people, I connected with a woman I worked with in Chicago 35 years ago, and I haven't seen, and maybe not that long, 30 years ago. And it's just like wanting to get back to a time where things were simpler. But also, we discussed this before we got on, that we don't necessarily want to go back to exactly that time, right? Like this new normal is also reframing what the priorities are in our lives and how we can pivot in a way that's going to be healthy, where we don't all remain socially distanced forever, but we also figure out how to take time and take those breaths. So speaking of taking those breaths, can you give us, right? I'm like type A personality. I want to be like, okay, great. Give me 3 things to do to handle my anxiety that is going to work for most everybody, and also ways that I can also filter this to our teenage boys, our littles in our life, our parents that we're worried about, so that we can just give them just a few techniques or tools that's going to help them manage this. What would those look like, Kim?
I just want to clarify the question. So you're asking about practical tools for anxiety, not reevaluating, thinking about future, what you want to take with you.
Yes. Yeah.
Okay.
I threw that in there just as sort of.
That's okay. I was like, I can.
Secondary.
Okay. So first thing, number one, without question, the most important thing for the practical anxiety is breathing. It really is, because it's the only thing that we can do, that we can control, that taps into the autonomic system. So, I can't say like, change my heart rate, change my heart rate. I can't say to myself, change my heart rate, but I can alter my breathing and change my entire body. I can actually alter and trigger the parasympathetic nervous system response. So every like anxiety intervention, relaxation intervention is built on breathing. So that's the first thing. So with littles, I would teach them some breathings. I'm laughing because, my own kids, as a parent, your kids love to have you teach them things. So for example, one little breathing thing you can do with kids, and I'm remembering my own kids saying, I don't want to smell the flower. You can say to your kids, smell the flower and blow out the candle.
Yes.
Because we don't want kids, if you tell kids to take 10 breaths, what do, Alan? They do this. That's the opposite, right? That's hyperventilating, right? So don't 10. Or you can tell them, like, show me the biggest bubble that you can blow. So we want them to learn to take deep, slow breaths. With and for adults, all different kinds of breathing exercises. And I'll do a visual exercise with you guys in a few minutes. But breathing is really the cornerstone. And there's some great apps. Probably the app that I like the most that I use the most is the Calm app. It has really short and long exercises and lots of different teachers on there. It's got sleep stories, which I think can be really helpful for people who are struggling with sleep. One of the things I like about the sleep stories is that they are designed to help you with sleep, but not just focused on go to sleep. So they're a side thing.
And Matthew McConaughey even does one.
Matthew McConaughey.
Oh, I'm in then. That sold me, Dr. Coffman. Right?
I'm telling you, his is really good. That is true. My AirPods just went out, so I'm having technical. Can you still hear me?
We can hear you.
Just making sure.
Yeah.
Okay. So I'd say breathing, get exercise, there's no question, you know, physical exercise, you can get 20 minutes, get your heart rate up, getting outside. If you're going to do 3 things, those are the 3 without question. Get outside, breathing, exercise, and it's sort of a reset, right? Getting a kind of reboot.
Well, my 19-year-old has totally saved me on the exercise part. She invited me. So I got 2 first. I got to spend time with her and exercise. She has me doing the triple secret sorority video workout. And so all the fraternity boys in the fall are going to notice me. I got that to look forward to.
All right, we're going to have to put those little TikToks on our Facebook page,
right.
because I think everybody now wants to see not just the calling Dr. Coffman, the cheering Dr. Coffman, right? That'll be our next one. Well, look, this has been, I can tell you, as you were talking, Kim, I felt myself even, you know, being very conscious of my own breathing and just taking it. It's amazing. Like from this morning, watching you on a video to now talking with you face to face on Zoom. That little thing I have taken for granted. And so it's such a gift to give to me, and hopefully that I can pass on to the family, that, you know, the being outside, the exercising, but the breathing, oh my gosh, right? Like just to take time to breathe, because I don't think we realize how much we're all holding in until we exhale.
Yep.
And we're at 20 minutes, Allison.
Yeah.
Well, it's been awesome, Kim. Thank you so much for, so Kim's husband, Jeff, is a good friend of mine and has helped me a lot, just talking through and being vulnerable and sharing life together. And Kim, you're much more fun to hang out with. So don't tell him I said that. But we're going to have both of them on next week. To the other part, I think, in realizing how much stress and anxiety we're experiencing is some real grief issues that all of us are dealing with. And so we wanted to bring Jeff in with Kim to help us talk through what that looks like, and giving ourselves permission to have grief and deal with it. And so as we kind of, we always try to bring it back to being grateful. And Kim, we are so grateful for you and just the work that you do every day, and those like you who have a heart to step into people's lives and be safe and to help them talk through their lived experience. And you really are a blessing. And thank you. Thank you for that. And I would pray that we receive the grace from that, and that we all kind of look around those people that we live with and that we share life with. I like, you know, what you were talking about the balance, and you know, for me, my friends and family are how I manage a lot of my stress, and having to renegotiate those rules a little bit in regards to what we all have to give and how we're all dealing with this differently. And so I just appreciate everyone and the way that you share that love and seek to share that with those people around you, because we all need that right now. And I think too, it's just so easy. Allison and I like to manage each other's judginess as we talk through just, you know, all the worry, because it's easy to go from being anxious to being mean to other people. And I just pray that we'll all receive that grace as we interact with, you know, those people who we share life with. But Allison, do you want any last words?
No, how could I say it better than Dr. Coffman, right? Thank you as always for letting me hop on the Zoom call to call you, Kim, today, for sharing your wisdom. We're excited to have you back next week. I just want to mention that since Sunday is usually our typical show, it's Mother's Day, so we're going to take a break. We're going to figure out ways to safely social distance and celebrate that holiday with the people that we love. But for now, we offer you our grace and our gratitude for joining us, and we'll see you next time. Thank you guys so much.
Thanks, Allison. Thanks, Kim.
Thank you.